All right. Hello, everyone. My name is Dr. Chris Vogel. I'm a behavioral scientist and co-lead of the Insights team on the Vaccine Confidence and Demand team of the U.S. Centers for Disease Control and Prevention. After the COVID-19 pandemic emerged, media consumption in the U.S. increased by 60% compared to 2019. Many Americans reported feeling overwhelmed by the amount of information on COVID-19, especially as they're spending more time on screens than ever before. Constantly changing public health guidance and mixed messages from authorities in health also contributed and continue to contribute to a noisy, crowded information environment where it can be difficult for an individual to identify which information is not only accurate and credible, but also fresh and valid. How can you know what you are retweeting or sharing is still right when you share it? Why would you not share the post about a danger so your friends and family know to avoid it? Misinformation spread during the COVID-19 infodemic here in the U.S. has led to increased calls to poison control centers due to misuse of household cleaning products, ingestion of bleach, and improper use of medications such as hydrochloroquine and ivermectin. As the pandemic has progressed and vaccines came into the conversation, misinformation began to spread and about COVID-19 vaccines as well. Organized anti-vaccine groups have taken to collecting stories of individual tragedy and using them to convince others who see themselves in the tragedy to join what they see as their fight for medical freedom. Where high vaccine uptake is essential for us to move closer to the end of the pandemic, maintaining public confidence in the vaccines, vaccinators, and the health system is critical. Addressing the COVID-19 infodemic and the misinformation around vaccines is paramount given the practical issues with vaccination on a national and global scale. Misinformation about COVID-19 vaccines is especially concerning as it seeks to polarize the topic and exploit people's and communities' fears and distrust of governments and health systems. It also makes it difficult for people to find, distinguish, and act on credible information. However, chasing individual pieces of misinformation in attempts to debunk them ignores the real, larger social and cultural forces that cause these pieces of information to emerge and gain traction in the first place. Understanding themes of misinformation and the information gaps that exist, and then developing programmatic and communication approaches that address these underlying narratives is critical to better understanding the challenges of the infodemic and is especially important in our work to promote vaccine uptake. It's difficult to balance being responsive to the information gaps and misinformation we're seeing spread online and the outpouring of new content from our task force while also trying to balance the message fatigue that consumers were facing. Social listening tools are not built to help us track and recommend action around public health crises. So after many late-night brainstorming sessions, our Insights unit was born. Our Insights unit is currently staffed by 2 co-leads and 6 analysts, with our key product being a bi-weekly COVID-19 State of Vaccine Confidence Insights report. The report looks at multiple sources to help us better understand the communication landscape surrounding COVID-19. To develop the report, we look at social listening data, we hand search closed network social media platforms, analyze comments on our own social media channels, monitor stories in media and track the media requests we see coming in, review current polls and new research published in peer-reviewed literature, analyze calls and emails into the CDC's own call center, and of course track web metrics. After collecting and analyzing each of these inputs separately, our team comes together every other week to triangulate and synthesize what we're seeing. This is especially important as it allows us to weed through the noise and figure out what major themes are rising to the top in this hectic digital landscape. Our process has become more streamlined with time, and we're now able to better identify emerging issues before they become major themes. This work is part science and part art, as there is no way to determine what necessitates a threshold for a theme or emerging topic. After we review all potential themes, my co-lead and I review all of the team's notes and put together an outline of themes, emerging topics, and continuing topics, and circle back to the team. From there, our team determines the threat level of each identified theme as it relates to vaccine confidence. We look really at 4 levels: high risk, moderate risk, low risk, and then positive sentiment, with the differentiations in risk comes down to the impact it will have on vaccine uptake and vaccine confidence. After this, our team considers the directionality. This is helpful for context to allow people to see whether these conversations are on the rise or have remained stable over time. But as other topics have fallen in prevalence, a particular theme is now standing out. So our team then pulls all the appropriate information into one place, so my co-lead and I can write narratives that synthesize all the data and showcase the perceptions of COVID-19 vaccinations and how they might impact confidence in COVID-19 vaccines. However, what makes our work different than typical social listening and media monitoring reports is that alongside the narrative for each identified theme, we share ways to take action and address the information gaps, perceptions, and rumors that may have led to the themes in the first place. So the ways to take action typically fall into three categories. Communication. What content or information is missing? What messages do we need to disseminate and amplify? And what messengers do we need to work with? And then there's programmatic ways to act. What can we do to improve upon the issue? Perhaps create a website or identify a new process or system, or even reduce a particular barrier. And finally, research. What do we still not know that we could learn from perhaps survey data, focus groups, or listening sessions? This is the most important part of the report. At the end of the day, we want this report to find its way to people on the ground who can quickly take action. We have a direct link to our communications team on the Vaccine Task Force. They take each of our communication recommendations and break it down into actions to take to improve our agency's communication, from putting together a prepared response to a question that has emerged or a misperception that has grown. The overwhelming feedback we receive is that this paints a picture that not only validates what many people are seeing or hearing anecdotally, but that our ability to find misinformation or perceptions that are in the middle of the pack and highlight them helps health departments and organizations know where to focus next, what the needs are going to be, and more towards the social inoculation space we need to try to be in. Since the report began in February of 2021, we've seen the conversation shift and change dramatically. Our first report in early February heavily focused on how frustrated consumers were with state and jurisdictional eligibility and the lack of clear communication about who was eligible and why. We saw the beginning of the conversation related to the impact virus variants would have, and confusion about maintaining mitigation measures after vaccination, and confusion about what we did and did not know at the time about asymptomatic transmission of the virus. This was especially challenging as it began to make many people think that the vaccines were not a path out of the pandemic and into normalcy, and challenged the benefits of vaccination. And now at Report 13, we see consumers were concerned about the effectiveness of the vaccines in reducing the spread of the Delta variant, the imposition of future vaccine mandates, and parents' concerns, confusion, and frustration as children return to school. Recently, we did an evaluation of the State of Vaccine Confidence Report, and results from a recent evaluation of the State of Vaccine Confidence reports found these to be the most common ways people are using the reports. What the most common is informing communication strategies, right? What sort of messages need to be shared with the public? Additionally, how should these messages be tailored? Second, improve personal understanding of vaccine confidence issues. And here we're talking about people reading the report. Additionally, it informs partnerships with other groups and organizations. Who do people need to be partnering with to be those trusted messengers that share the message? Additionally, improving the understanding of vaccine hesitancy and access issues across special populations. And finally, to inform prioritization of vaccine confidence issues based on themes in the report. The State of Vaccine Confidence reports, the layout of the report, the methodology have provided some guidance for international partners, such as the African Infodemic Response Alliance, and specifically their weekly reports. Mis and disinformation knows no geographical bounds, and it spreads. We live in a more connected world than we ever have. Other countries can see the pieces of mis and disinformation as they emerge. So, for example, we were already seeing people talking about ivermectin back in June before it all came to a head last month in August. Other countries could have used this to act on it sooner. Additionally, individuals could use the reports to see the pitfalls of certain messages or policy decisions early on and address them. Additional early identified topics include access to vaccines and additionally concerns about vaccine mandates. If we were to receive reports from a global perspective, we could use it to inform our efforts. So for example, the African Infodemic Response Alliance saw similar issues of concerns around fertility. So thank you all for letting me come here and talk to you. If you'd like to be added to our State of Vaccine Confidence Report distribution list, please email the email on the slide. It's eocevent515@cdc.gov. Thank you, everyone.